hosting today's forum along with...
Hey, Megan, oh, never mind. I was just gonna ask if we could start recording, but it looks like we just did that. Thank you, Mandy. Sorry for interrupting.
Oh, it's okay. Okay. So I'm hosting the forum today with some of my colleagues that you see here. So today, the department will present the draft schedule for initiation in calendar year 2026 in order to accept feedback or advisement from the technical advisory panel. After that, we'll move on to public comments, and I'll go over how to make a public comment at that time. For now, to prevent any interruptions during the presentation, all participants are in listen-only mode. The chat has been disabled, and participants may only chat with myself or the co-hosts. This forum is being recorded, and it will be posted along with the presented materials by the end of today on the Rate System Reform webpage. And a notice will then go out this afternoon with those links along with instructions for submitting written comments. So again, we appreciate everyone's participation today and look forward to hearing your comments. And I'll now hand things over to Michelle to get us started.
Did she not able to unmute herself? Is she?
I was not able to unmute myself, but then somebody gave me permission, so thank you. I'm sure my kids would like to have that power in everyday life. You are allowed to speak now, Mom. Good afternoon, everybody. My name is Michelle Probert. I'm the Director for the Office of MaineCare Services, and nice to see what I will call a pretty robust crowd here on a Friday afternoon. So thank you. Thank you for joining. I'm just going to offer a few introductory remarks, and we'll be turning it back to my colleagues for the meeting in full. And I do apologize in advance. I might need to drop a little bit early. So first I will just say that we have, as you will see, continued significant progress on reviewing our MaineCare reimbursement for all MaineCare services. In addition to that fact, we, as you may remember from the past, have a goal, or had a goal, I will say, of moving MaineCare reimbursement so that 50% of reimbursement was tied to alternative payment models, which we are defining as tying at least a portion of reimbursement to the value of the care that is provided. And we started out, we set a goal, I think it was back in 2021-ish timeframe, Olivia can correct me, when we were at around 20%, and now we have well exceeded our 50% goal and are at 57%, which is very exciting. And I will note that also includes what I see as a big milestone this past summer with our accountable care organization, or for MaineCare, we call it accountable communities model. All of our ACs have moved to taking on mandatory downside risk in our model, which is a significant step forward in terms of accountability and our goal. In addition, I will say that on top of our goals of making sure that all of our reimbursement for existing services is adequate and efficient, data-driven, tied to value where possible, we also have had significant workload related to new services or changing service models for services, as well as the reimbursement, which are efforts that really need to work closely hand in hand with each other. And through that work, also taking advantage of new enhanced federal matching opportunities. One example of significant work in this regard is with our CCBHC model, our certified clinical behavioral. I can never say the word, Olivia.
Certified Community Behavioral Health Clinic.
Thank you very much, which rolled out this past year, and we're very excited about. And I'm especially proud of all this continued work and these accomplishments because this has been, despite of and alongside very challenging circumstances, both at the federal level as well as at the state level, in terms of having a constrained budget situation in the state, and then especially this past summer with the passage of the HR1 budget reconciliation bill that introduces significant cuts to the Medicaid program nationally. Over the years, as I've talked to other state Medicaid directors on the topic of reimbursement reform, I know that budget challenges in other states have at times been the downfall of their own reimbursement reform efforts. And last year at this time, I probably mentioned in some settings that, you know, I was concerned about what being in a budget shortfall situation would mean for our own MaineCare rate reform efforts. Again, looking at the progress that we've made, I am proud that I feel like we are still going strong in that regard. We have very much come to appreciate the necessity for the department to differentiate our rate reform policy and process, both for rate determinations as well as cost of living adjustments, from separately having sufficient appropriations from the legislature in order to implement those recommendations. I know that this is a difficult topic by its very nature, and there's some significant disagreement amongst different parties, but I do believe that we are all on the same page that transparency is important, that having a process and policy in statute that we all agree to, that really emphasizes the importance of data-driven work, of work that is informed by comments and data from stakeholders and other interested parties themselves, is really critical to make sure that our recommendations, to inform our recommendations as well as our actions. And when we have good policy and process and we have good documentation, when the department and or the legislature are able to take action or determine allocation of resources, then we have that data-driven approach and we have the recommendations at the ready. Whereas in the past, again, when there was action, it could at many times not be so informed in terms of priority of service or what the appropriate adjustments to rates would be. And I'll also say that when you are in a context of cuts at the federal level, as well as other budgetary constraints, making sure that our reimbursement is adequate as well as efficient is even more important. Efficiency is important because, especially when dollars are tight, states cannot afford to overspend. And adequacy is important because especially when providers are experiencing tight times and when we are facing potential, or really I'll just say actual disenrollments in the coming years that will impact our members, current members, new potential members, as well as our providers, making sure that what we are paying is adequate to cover the cost of services is also critical. So again, we are in pretty tough times, and I won't try to put a gloss on that. But for me, it just underscores the importance of this work. And again, it does make me proud that we have continued to make good progress and remain on the same path together, because I would say that it's just more important than it even has been in the past. So once again, I appreciate all of you being here today and offering your expertise, listening to the conversation, and look forward to receiving your input going forward as well. And I was very clearly told who I was turning this over to. I'm turning it back to Megan Scott. So thank you.
Thank you, Michelle. So I will go ahead and share my screen. Okay. Just make sure that you can just see the agenda and not my notes. Okay, thank you. Okay, so I'll start with going over our agenda for today. We will start by having the technical advisory panel introduce themselves. We'll briefly review the rate reform law and the goals for rate determination in 2026. We'll share progress made on the 25 schedule, and then we'll review the draft 26 schedule and discuss the rationale for the sections the department has proposed adding for the year. We'll then briefly review what services still need a rate determination for the department to follow the rate reform law. And then we'll then transition to comments and questions. We'll start with the TAP, and then as time allows, take public comment. And then lastly, we'll end with next steps. So next, so if the TAP members could introduce themselves. I don't think I saw Karen Lee, but is Marty here? You want to go ahead and introduce yourself, Marty?
Oh, there we go.
Okay.
Sorry, took a little while to unmute. Hi, I'm Marty Hooper, the Life and Health Actuary at the Bureau of Insurance.
Okay. And is Heather here today?
No, she's not here.
Okay.
We have Amanda, Mark, and Meg.
Okay. Meg, did you want to go ahead and introduce yourself?
Thank you for unmuting me. Meg Garrett-Reed. I am the Executive Director of Maine's Independent Office of Affordable Health Care.
Okay. And how about Mark?
Should be good now.
Good afternoon. Mark McInerney, Director of the Center for Workforce Research and Information at the Department of Labor. Thank you.
And Amanda.
Hi, Amanda Rector. I am the Maine State Economist, part of the Department of Administrative and Financial Services.
Okay, great. Thank you, everybody. Okay, so I'll just go over the rate reform law briefly. So the law passed in 2022, and it codified the rate reform system for MaineCare and the process we're following today. The law supports a transparent process for rate determination that allows for input from interested parties. It assures that rates are reviewed on a set schedule and that relevant state and national data is used to inform rate amounts and payment models, with emphasis on models that promote high-value services by connecting reimbursement to performance. The law also established the Rate Reform Expert Technical Advisory Panel to provide expertise to inform the rate determination schedule and other related technical matters. And per rate reform law, on an annual basis, the department will consult the TAP on the draft schedule, recommendations for the coming year. And after the consultation today, we'll share the proposed schedule to our public website. We'll provide an opportunity for public review and comment. We'll post a summary of all comments to our webpage, and we may conduct off-schedule rate determinations as the department finds appropriate. So with that, I'll now pass things to Olivia Alford to walk us through the priorities for 2026.
Great, and good to see everyone. I'm Olivia Alford. I'm the Deputy Director of Policy and Programs for the Office of MaineCare Services. So we want to start off with just a little bit of explanation for how MaineCare and the department approached the calendar for 2026. And we'll go through the details in a little bit. But at a high level, what we're looking for as we go forward into 2026 is to really think about where we are in that 5-year process to get through the rate reform statute's goal or deadline of having all MaineCare services touched by rate reform within a 5-year period. We are in 2026 will be essentially year 4 of that work. And so we really need to think about what can we do to make sure we are on pace with this work for the 5-year period. So that means really looking closely at which services have yet to undergo a rate determination and where is our capacity to be able to start that work. So we, of course, are going to look at including services into the rate schedule that have not yet gone through a rate determination process as of the passing of rate reform 3173J that Megan just discussed. And then we know that once we get through that initial hurdle, we'll be able to transition services into more regular schedules for review and adjustment. What we've learned over the first several years of doing this work is that when possible, it's great to do rate determinations for services that have similarities across different sections of MaineCare policy at the same time or in similar timelines so that they can inform one another, and we're looking for comparisons and appropriateness across settings. That has become very apparent in recent work. We're looking to embed that kind of thinking into future work as well. We continue to hear and want to be responsive to services that are experiencing member access issues that we feel like we can address through the rate reform process as a first step in thinking about how reimbursement may play into those access issues. The challenging area, of course, there's several service areas where there are access concerns across Maine for various reasons, reimbursement and non-reimbursement related. So it's a careful consideration of when that can mean that a service can get put on the priority schedule for a year. And you'll see some of that for 2026 playing into our decision making. And then specifically for this year, part of when I say thinking about how we can fulfill the rate reform expectations of touching all services within a 5-year period is in order to embark on new service rate determinations, we need to finish work that we've started already. And you'll see in this upcoming 2026 calendar that we are prioritizing in a way, finishing work we've already started, because that effort is extremely important to be able to take on new rate determinations, but also to think about how the rate determination process is one step. It's the first step often into determining what it will take to actually implement a recommended rate. And so we really can't we need to get through those steps in order to move forward to implementation with appropriations and other rulemaking and other approvals that need to take place after a rate determination has been completed. And we're in a place now where we really need to focus on completing rate determinations. Next slide. It went blank for me. I don't know if it went blank for everyone else.
It's blank for me too. Oh, there we go.
Okay, let's come back. Yeah, I have it, so I can look. So essentially, another area that, of course, Michelle touched on already is that when we think about our budgetary constraints going into the future, we will be considering, and we are considering, the importance of prioritizing rate determinations and then implementing rate determination recommendations that are data-driven and appropriate, and that recommend potential savings to the department. Again, in the context of making sure that what we're paying for is the most economic and efficient for what the data is showing us for the services that we have gone through a rate determination for. We will still try to prioritize, again, escalated member needs. And I already spoke to how all of these things we need to remind ourselves that the rate determination process is separate from implementation. And so again, that's why we need to make sure that we're being realistic and efficient with how we do rate determinations to get to implementation conversations. Next slide. All right, so it actually wasn't that long ago that we talked with you all about the 2025 rate determination schedule that we're in progress on right now. So we wanted to first talk about some of the things that we've already completed in 2025, just to highlight where we have had success in completing work. There was a budget initiative and an effort to revisit Medicare covered family planning services and long-acting reversible contraceptives that we completed that rate determination in 2025. Michelle already spoke about completing the rate determination that enabled us to then implement certified community behavioral health clinics under our federal approval as a Medicaid demonstration state for this service, which again came with enhanced match. So it's very good to be able to complete a rate determination to draw down enhanced federal match when we implemented this model in 2025. We completed the mobile crisis response teams rate determination, which again is another one of the alternative payment models that when implemented, which is not yet implemented, will draw down enhanced federal match for that reformed service. So another kind of one of those similar reform efforts that Michelle spoke about. We completed the rate determination for temporary high intensity services under our Appendix D, Children's Residential Service section, and the psychiatric residential treatment facilities rate determination, which is under section 107 of the MaineCare Benefits Manual. And I'm going to hand it over to David to talk through what has happened in 2025 regarding cost of living adjustments.
Great, thanks, Olivia. I am David Jorgensen. I'm the Associate Director of Data Analytics and Rate Setting. As Michelle mentioned, we have had some budgetary constraints this year, but the legislature was able to approve in two separate packages some appropriations for COLAs for MaineCare services. So in the first set of COLAs that the legislature approved earlier in the last legislative session, we had funding for a 1.95% COLA for the services listed here, effective July 1st, 2025. And then on the next slide, in the second set of funding that the legislature appropriated for COLAs, that funding wasn't available. The appropriations weren't available to MaineCare until September, following the 90-day delay from the session adjourning. But in September, we implemented a 1% COLA for the services listed here, retroactively to July 1st. So those are the COLAs we have implemented so far this year. And then we've shown this slide in past technical advisory panel consultations, and wanted to update you with what our spending looks like by section of policy for the state fiscal year 2025. Proportionally pretty similar to previous years. It's hard to notice without comparing these slides side by side, but we have made additional investments through hospital reform and nursing reform, nursing facility reform, excuse me, compared to our FY24 spending. So those services did increase a little bit proportionally compared to other services. Largely overall, these proportions have stayed fairly consistent year over year, though. All right, and that I think does it for my slides, and back to Olivia.
Thanks, David. And your points, it's funny because this is a calendar year schedule that we are talking to you all on, and this, as David mentioned, nursing facilities and hospital rate reform were very large efforts completed in prior years, and some of them implemented, and nursing facilities implemented on 1/1/2025. So we talk about the timeframes in different ways. So that graph is helpful to kind of capture some of the work that was done in previous years and how that's being implemented now in what you've shown us. All right, so we're going to go through the proposed 2026 rate determination schedule, which will be posted online later today and again, we're walking through it now, but you'll be able to access this recording and also the materials online by the end of the day. So one of the things to note is that there are several pieces of legislation that play into the rate determination schedule for 2026. Several pieces of legislation reflect work that is in progress that will continue to be on the schedule. We'll talk about that. And there's other pieces of work that inform the schedule for things that are starting new in 2026. So this just shows you the kind of the breadth of the legislation that has come in at different times and advising MaineCare or setting deadlines for the department on how to proceed with certain services, which absolutely has to be taken into account regarding our schedule each year. Next slide. So you're going to see, how many slides is it? Let's see, 2.5, 3 slides that reflect all of the work that's in progress from prior rate determination schedules and all of them being on the 2025 schedule. We're not going to go over the justification for each of these items because we did that when we initially proposed to put these items into the rate determination process in a prior year. But what we are going to illustrate is that there are a lot of things that are still in progress, to get to my point of why we really do want to try to minimize the new services that we're going to put forward in 2026 to make sure that we can get through these rate determinations. What I also want to call out is that, and you can go back to the first one, first slide, is we are also simplifying the way that we're presenting work that is in progress. All of these services have work that's being done on them to get to the next phase of rate determination. Sometimes we go into a rate determination knowing that we're going to do a full service model redesign, and we start with the research and looking at the evidence and other best practices around the model itself. Sometimes they're new services entirely. Sometimes it's a change to an existing service. Sometimes we start the rate determination work more thinking that it will be more straightforward and that we won't need to do service model design, and we end up finding out that there actually are changes we need to think about for the service definitions themselves, which providers deliver the service, and really it's a process regardless. So what we're doing through a simplified approach in communicating here is coupled with what will be a more transparent process of regular every other month reporting to the MaineCare rate reform subcommittee of the MaineCare advisory committee. The documents that we share more regularly with interested parties around where is each of these in the process and what is the next step and when is that next step anticipated. So for that level of detail, we're going to be more transparent going forward after receiving some feedback from you all in different contexts and different forums about how it's helpful for us to be clear what is the next step and when can we expect to see movement on these projects. So that detail will be in those contexts and not in the schedule itself. All right, so we have community paramedicine, new model to MaineCare, coordinated specialty care, which is, you may hear that referred to as first episode psychosis, evidence-based practice for young people's first appearance of a psychosis episode. Also a new MaineCare model, although currently we have incorporated the optional service into our certified community behavioral health clinic structure. This would be the standalone fee-for-service version of that model. We were and are in the development of a family planning alternative payment model, which would be an option or an alternative to, I should say, the current fee-for-service method of paying for family planning services. We have a very large rate study reflected in the fourth row there, which we call the Home and Community-Based Services Clinical Rate Study. But really, when you look at that row, you look at the several, I can't count up, the 8 or 9 sections of policy that are reflected in that work. It's an enormous rate study intended to look at clinical, nursing, care coordination, supportive skill building, assistive technology, personal support services. It includes by therapy, that means occupational therapy, physical therapy, all within all those sections of policy. Speech therapy, it's a very large study, so that one row kind of doesn't show that level of effort. The next one, also a very large rate study that is near completion, but needs to get across the finish line, regarding HCBS services for individuals with intellectual and developmental disabilities or autism, including the new lifespan waiver, which is an entirely reformed way of thinking about our waiver programs for that population. Also needs to be completed. Interpreter services, that's more straightforward. We can go to the next slide. Multi-dimensional family therapy, also a new service to MaineCare, underway with that work publicly as of last week. Nursing facilities, specialty units. This is the kind of the remaining part of the nursing facility rate reform that we did implement the majority of the reforms starting this past January, and this is another element of nursing facility reform that would complete the spectrum for nursing facilities. Palliative care is a new model for MaineCare. Pharmacy services, looking at our pharmacy dispensing fees. That's an ongoing work. Primary Care Plus is our primary care alternative payment model that was launched and has a goal to advance the alternative payment model even further to support primary care. It's a multi-year project. This one is not expected to be completed within the next calendar year, but work is continuing. And then we have 3 private non-medical institution or PNMI services that are all in progress and in different phases of progress. Appendix C, Appendix E, and next slide, Appendix F. Those are significant scopes of work for each. Psychiatric hospitals, which we're looking to, again, revisit and think about the way that MaineCare is able to pay for those services. Part of this is tied up with the opportunity we have with the 1115 waiver to draw down federal match for adults in these inpatient settings that we currently do not have federal authority to do, but are requesting this waiver to do that, which would really mean a change to our entire reimbursement model for these facilities. And then a lot of really important work around school-related health services, which will include, as you can see in the asterisks, ambulatory, what is currently called ambulatory care clinic services under Section 3, but also includes new services. And this is a priority area that needs to be accomplished and finished in the next year. And lastly, again, a service that is essentially an evolution of an existing service, the substance use disorder health home model that builds off of the opioid health home model, also in progress. So even though we only have 45 days left in calendar year 25, we are beginning to work on these 2 final items that are on the 2025 schedule. Hospice services and laboratory services. Those had budget initiatives that were cost savings reflected in the last budget, and it's important to get through that work to achieve those savings and to look at the services and the reimbursement to make them more equitable for how MaineCare pays for services. All right, so I am going to walk through each in more detail and at a slower pace, each of the proposed new services that we would be adding or starting in 2026. And I'm going to just go through each one so we can go to the next slide. Okay, so we are proposing to include dental services, a comprehensive dental services rate determination on the calendar in 2026. This has been an area of a lot of interest and attention, rightfully so, as there have been continued access issues for all populations, but also special populations such as people with intellectual disabilities and children having trouble accessing dental services, even though this work dovetailed with MaineCare's adult dental benefit expansion in July 2022. So when we did expand MaineCare's coverage of dental services to all populations in 2022, we did a rate determination study, a full one, to set those new rates. Technically, that was just slightly before the rate reform legislation passed. But that methodology that we established at that time has since come under question, and we ourselves at MaineCare have determined that we need to reset the methodology for these services. In 2024, when we were looking to just update the rates on the annual basis that's required when you have a methodology that we had established, which was looking at commercial payer medians and other Medicaid state agencies, we were going to look at that annually just to make sure that we were updating our methodology with that model. We actually found that those would have resulted in rate reductions. Overall, some services up, some services down, and it would have been a net loss to providers. So the department at that time held existing rates flat so that we could revisit the methodology as a whole to make sure that we were able to implement something that was sustainable long term. With that, we are proposing to prioritize that redetermination in 2026. Next slide. Okay, doula services. There's actually several services related to pregnancy or maternal health on the slide, some for different reasons. For doula services, there is an LD, there was an LD, a bill that requires the department to cover doula services and to initiate a rate determination by January 1st, 2026. This work does align with a federal grant that MaineCare received in 2025 called the Transforming Maternal Health Model. We were one of 12 or 15 states, I can't remember now, selected for this award. It's a competitive award that's bringing $17 million to Maine over the next 10 years to improve maternal health outcomes. So again, this is an example where we are able to leverage some federal support and resources. And it aligns with legislation to get to a place where MaineCare has coverage for doula services and ideally improving the health outcomes and experience of care for pregnant people and their newborns. So we will start that work in 2026. Next slide. This one, hospital professional reimbursement. This was previously discussed and on the calendar for 2025. You'll see that we made a note that we are just moving this to start in 2026 instead of 2025. In brief, there was much discussion in the legislative process last year about MaineCare and the department wanting to address professional reimbursement for hospital-based services, and what are the ways that MaineCare could do that? And when we say hospital professional reimbursement, we're talking about physician services and other services by licensed or qualified providers that are delivered in an inpatient or outpatient hospital setting. These services are currently paid out one way and then cost settled at the back end. We have been, as a whole, working towards moving away from cost settlement as a method of reimbursement where it doesn't have a tie to accountability or cost controls. We talked about this a little bit last year. The result of the legislative process was a directive for the department to change our methodology for these services starting 7/1/2027. So now backing into that date, we are going to start that work next year so that we can do the determination and have the new service model, this new service reimbursement ready for that effective date. That would be our goal, to align with the legislation. We do anticipate cost savings from this work. Next slide. Lactation services, and we probably should have put all the maternity ones together, but lactation services was a separate bill requiring MaineCare to cover lactation services. Not expected to be a heavy lift from a complexity standpoint. However, it is looking at MaineCare covering a new type of provider, an independent certified lactation consultant, and thinking about the other ways that lactation services can be reimbursed through existing methods within the MaineCare program, such as when someone's inpatient at the hospital after delivery or through their physician's office. So there's different elements to this, and due to the legislation, we are suggesting that we start this work in 2026. It is not directly related to the triggering maternal health work that I just mentioned, but of course is within the same vein of who we're trying to support with this effort. Next slide. This is the last maternity item that's showing up on the 2026 calendar. This is another requirement of the Triggering Maternal Health Federal Award that we received. This will be a value-based alternative payment model for maternity services, including prenatal, postpartum services, and the labor and delivery costs. What's interesting about this is that CMS is developing this model for us. So our rate determination for this work will be a little bit different than other elements. So, CMS is developing the model. They are releasing it for 2026 to start state Medicaid agency level conversations with our provider community. So we will be, this will be the timeline that they introduce it, and this will be the timeline that we start having conversations about this model with Maine providers, and still following the rate determination structure, as it will still be a change to Medicaid reimbursement for these services. Almost done, and then we will get to the next section. And yeah, I would encourage other folks from MaineCare to reply to the chats if you, for the one that's outstanding. So this is an area that is both not yet touched by rate reform and represents an area where we have access concerns. So there are plenty of durable medical equipment supplies that are not covered by Medicare, and therefore we could not benchmark to Medicare when we previously established methodology for how to pay for DME. These are very important items to people's ability to maintain in their home, to maintain their health, their access, and their conditions to a wide range of activities of daily living and other things. So it is one of the non-Medicare coverage areas that we are addressing first. You'll see there's several other sections of policy that have individual services that are not covered by Medicare where we have to do additional work, but we're prioritizing doing this area first due to access concerns about some of these items and how they impact members' lives. All right, and the last section is services provided by pharmacists. So there is one LD related to this work, but there's also several other areas that impact that will likely fall into this scope of work. The legislation driving this addition to the schedule talks about pharmacists being able to prescribe, dispense, and administer HIV prevention drugs, such as HIV pre-exposure prophylaxis, PrEP, commonly referred to as PrEP. But there are other services within the pharmacist scope of practice, such as vaccines, family planning, smoking cessation, which should they be, or when they become a Medicaid billable provider for services, that would be something we would determine how would we pay a pharmacist for doing these services. Again, these services are covered when other professionals deliver them, but there's never been a study on what would be the appropriate reimbursement rate when a pharmacist is the one delivering these services. And so that will be the kind of the question and the work around this rate determination. So feel free to add questions to the chat and we'll get to them later. And there also will be, as you know, a public comment period and the TAP. Sorry, was it just me who left temporarily or did we all get kicked out? Just me?
I think it was all of us.
Oh, okay. David looks very calm.
It's still recording.
Oh. David, were you here the whole time?
I noticed a lot of people glitched, and I think a number of people dropped off or may have temporarily dropped off, but I see.
Yeah, I can't even see. Yeah. It says there's still 40 participants, but
okay.
Okay.
We'll keep going. Sorry about that. All right. So the this is the last section before we get to the comments. So everyone's always interested and we are closely tracking which services have not yet been touched under the rate reform law. So have had a rate determination since the law was passed. And this is our most recent tally of those services. So we have ambulance services, ambulatory surgical centers, freestanding dialysis. And I'm not going to go through the rationale on each slide because, again, we are talking about services that will need to be on the schedule for 2027. So at this point, it's not a matter of, it's just a matter of putting them on that calendar because we do intend to reach all services in 2020 by 2027, by the end of 2027. The next ones are our community care teams, intermediate care facilities for individuals with intellectual disabilities, commonly referred to as ICF-IDDs, rural health clinics, again, had rate determination right prior to, or pretty recently to rate reform, but not after rate reform law. Similar with PNMI's B and D as a whole, the substance use disorder treatment facilities and children's residential care facilities prior to rate reform did go through a similar process, but it wasn't after the rate reform law, and they're up for needing to be revisited as soon as we can get to that. Next slide. And then, as I mentioned just previously, a lot of non-Medicare covered codes within a whole bunch of sections. So we did a big, large standardization to Medicare rates in 2022, and we need to both revisit the general standardization to Medicare, I should say, but also specifically the codes that were not covered by Medicare within all of these sections. And we're deciding the best way to approach that work because it may not be piecemeal. It may be more of a group, kind of a group effort around these services. That is TBD. Next slide. I will turn it back to Megan to walk us through the timeline.
Okay. Thank you, Olivia. As you see here, the draft schedule will be posted later today. And then on December 8th, the MaineCare Advisory Committee's Rate System Subcommittee will hold a meeting to discuss the schedule, and they may develop recommendations to present to the broader MAC at their January meeting. The deadline for written comments will be December 17th, and please submit all written comments to ratereform.oms@maine.gov. And then once comments have been reviewed, we'll post the comment summary and final schedule by January 16th. So now we'll transition and we'll accept questions or comments from the technical advisory panel, and then we'll move on to public comments as time allows. So TAP members, please go ahead and raise your hand if you'd like to make a comment.
Are we able to take the PowerPoint down?
Oh, sure. Yes.
Please, thank you.
Stop. There we go. Okay, it looks like
and then I think we realized we can sorry, jump in. We can have Bill Montejo is here in place of Heather Hyatt, so we can have him introduce himself before we go to Meg for her first comment. And we might need to give Bill permission and turn his video on for him.
He should be all set. Yeah.
Hello, everybody. I apologize, but it will not allow me to turn my camera on, but I can turn my audio on. So I'm Bill Montejo, Director of Licensing. I'm here on behalf of Heather Hyatt.
Thank you, Bill. Sorry about that. I think when we kind of glitched, that setting changed somehow. Meg, do you want to go ahead?
Yeah, thank you for the opportunity. I had both a comment and a question. Comment-wise, just understanding lots of competing demands. I understand and appreciate the Office of MaineCare Services, balancing legislative directives with other priorities, and just wanted to voice support for the notion of thinking about access challenges in thinking about prioritization of moving forward. Appreciated Michelle sharing some of the metrics on dental access and kind of improvements in growth there. But that is an area that we do hear about from folks in terms of access challenges on an ongoing basis. So just kind of wanted to voice support for thinking about that, and really helpful to understand a little bit of the history there on the rate setting and adjustments. For the question, I just wanted to ask it's interesting thinking about the number of services that you mentioned for focus this year that are part of payment models and payment reform. And I was just curious if you could say a little bit more whether in all cases in those processes you're needing to think about both kind of a fee for service rate and potentially a capitated payment, or whatever the payment methodology in the model is, sort of maybe just a little bit more about how that process works from your perspective, recognizing it may vary, because that was something I was just curious about from a more technical perspective.
Yeah, I can start with that. So under rate reform, it actually is part of the legislation, or the statute, I should say, that we do consider where an alternative payment model is appropriate for the service, and where it may help us collectively reach the outcomes that we want to see. It's taken a lot of different forms for what that consideration process looks like. From a more basic level, what it does include every time is to look at what other payers are doing, including what other Medicaid agencies are doing, to see first if there is a model of payment or service delivery that exists elsewhere. We always like to look at those first and try to borrow what we can from those examples. We've also recently seen that we have a lot of evidence and a lot of examples internal to MaineCare in one service area that can be translated to other service areas and should be considered as an option. Sometimes it makes sense to say, let's apply the same methodology for a pay-for-performance structure in a new model or a new service, or a service we're looking at, just like we have in another service area. But there's often differences that we need to take into account, where it's a different provider group, maybe the goals are different, maybe the data availability is different, and we kind of go through a whole process to see where an alternative model may or may not make sense. As the former director of delivery system reform, I also have found it really great that over the last several years, we've had providers step forward wanting to see their service shifted away from fee-for-service in several cases, and they want us to consider a per member per month model, or a weekly rate. And we've been successful in doing that in certain areas, and other areas for very, but is coming from the providers themselves. So really all of those things coming together. And I would encourage, this group to definitely advise if you see an area where you think an alternative payment model would better suit the service delivery being whole person, flexible, team-based, so that we could get the outcomes we're looking for.
Any other TAP members want to make a comment? Meg again. Let's see. There you go.
Sorry, me again. I was just going to add on at the end, another thing that stood out to me in the conversation was the discussion of needing to think about benchmarking for services not paid by Medicare. Guessing based on the categorizations there that in many cases those services wouldn't be covered by commercial plans either, but just wanted to offer, to the extent that there is any overlap with commercial coverage where there may not be with Medicare, I'm more than happy, my team to help with thinking about considering commercial rates for services. That's an area where we do a lot of work on. So I think that's the last thing for me. I'll leave it there, but just wanted to chime in with that piece too, because recognize that's probably challenging and adds some extra complexity to the work.
Oh, thank you. And we'll take you up on that. And we have been doing that. And part of our comprehensive benchmarking report includes looking at commercial rates. And we've been interested in a lot of different ways in looking at how our rates compare to commercial rates when available. So it's an important lens for us to look at. And David or Michelle, feel free to add more if you'd like.
Okay, any other TAP members? Thank you, Meg. Appreciate your comments. Okay. Seeing none, but obviously feel free to chime in if you decide to. So we will now accept questions or comments from the public. So to make a comment, please raise your virtual hand. We'll call on you in the order of hands raised. You can raise your hand by choosing participants or reactions within the controls at the bottom of your screen and selecting the raise hand icon. Those participating by phone, if there is anyone, will select *9 to raise or lower your hand. Please leave your hand raised until you're called on. We'll call on the name or telephone number of the participant and request that you unmute your line. This request will appear for internet users as a visual prompt on your screen, and for telephone users, a recorded voice will prompt you to unmute your line by pressing *6. Once unmuted, please begin your statement or comment by stating your first and last name, your title, organization you represent, or your affiliation. For example, if you are a MaineCare member, a guardian, or other interested party. We ask that you please keep your comments to 3 minutes or less to allow everyone the opportunity to speak. At the conclusion of your comment, please lower your hand. And just as a reminder, the intent of today's session is to accept feedback on the draft schedule that we've presented for initiation in calendar year 26. We aren't able to provide details on resulting rates that may be implemented. At the conclusion of today's meeting, we will transcribe all comments and include those in the comment summary, along with any written comments received by the December 17th deadline. So if anybody would like to make a comment, please raise your hand.
And we'll definitely give folks a minute, but also understand that's a lot of information. And we talk about these schedules and these services every day and all week long. And so we can go through them quickly sometimes. And we did go through things a little bit quicker today because we had just kind of wrapped up the 2025 calendar process not so long ago. But a lot of materials are available online, and this recording will be available online. And so we absolutely appreciate that some people might want to wait for the public comment process, which we'll talk about in just a minute. And that is a way to really, articulate your questions, think about the services, and we appreciate all those comments each year as well.
It looks like we put the email address again for written comments in the chat. And I'll go ahead and share my screen again so that you have some resources and my contact information in case you have any questions.
And we will, can you reiterate just the comment period deadline, Megan, and then also for the MaineCare Advisory Committee, we'll work with the subcommittee on making sure that they have time to review this with the full subcommittee as well, so they can have that extra MaineCare Advisory Committee meeting as well. But for the general public, what is the comment deadline?
December 17th. So you have just about a month for comments.
Okay, great. So thank you all for being here. This will be posted online with the full e-message this afternoon, I believe, with the links to everything. So if you do get in, we hope you are getting our e-messages. You must be because you're here today. And that is the best way to stay up to date about all of the happenings regarding rate determination, not just the schedule, but asking about like the kickoff meetings, or when are we collecting data, or when are we doing presentation of draft and final rates, when are comments posted. All of those things happen through the e-message process. So I encourage you to sign up for any area of interest for those. Thank you all very much. And if there's nothing else, we will close out for today. And I hope you have a nice weekend.
Great day, everyone.
Thank you.